This video is on scar revision and mole removal of the nose. You may wonder, why am I talking about two very distinct categories in a single video? Because both of them involve cutting on the nose, in the middle of the nose somewhere, and maybe removing some tissue. And so they both follow the same basic principles. Part of the video I'll sort of segregate and talk more about scar revision. Part of the video I'll talk more about mole removal. But they really are incredibly linked together. So let's first talk about general principles of reconstruction. So the tip of the nose is highly mobile. You can see how mobile it is, right? When I over here, it's semi-mobile because it's basically carved, but it's mainly fixed. Here it's solidly fixed. So bottom third highly mobile, pretty fixed and very fixed. But what's very interesting is the skin has the opposite quality. The tip of the skin, it's stuck. It doesn't move. The skin is stuck to the underlying cartilage. It cannot be moved. Now watch this. If I go to the middle skin, hey, it slides. I can slide my skin on top of the nose. Look at the top. Even more slide. In fact, not only can I slide it, I can actually slide tissue down from up here. So why is all this so important when we're talking about reconstruction? The second category of skin sliding is the number one thing that allows me or prevents me from doing an easy reconstruction. So let's use an example. Let's say I've got a mole on the tip of my nose, okay? If I cut out that mole, let's say it's a relatively large mole, even if it's a small mole, the skin won't close. The skin is so tight. And I've got to undermine, which I'll explain more in detail, undermine the tissues to close it. That can cause it to pinch in, it may not look right. So what I've got to do when I'm doing a mole removal off the tip of the nose is oftentimes do a reconstruction, making cuts all over the nose. You go, why would you do that, Dr. Lamb? I've done that. I remember this wart-looking nose. You could not have a conversation with this woman without seeing this big round wart sitting in the middle of her nose. If I shaved it off with the depth of it, it would have come back in 6 months. So I had to cut the whole thing out, full depth, and then I had to do like a cancer reconstruction as if she was missing the tip of her nose by rotating these flaps down the nose. And the reason I did it, my mentor always said, it's always worth trading a contour problem for scars. Now that's not always the case. If you've got a tiny little mole, look, it's not worth having cuts all over your face or all over your nose just to fix that. But when it's a tiny one and you want that corrected, when it's an ugly one where it really justifies those scars, maybe we'll consider doing it. As we go up the nose, the whole situation changes. When I've got a scar or a mole up here, it's very easy to close. I can easily recruit tissues from the sides to the top and close it. I can make sliding incisions. It's so much easier to close. So the farther up the nose you go, the larger I can remove something and the more comfortable I'm removing it, whether it's a scar, whether it's a mole. Of course, moles are harder in the sense that unless the scar is wide, the mole I've got to remove tissue and then close it. With scars, I typically only need a couple of millimeters out. However, scars require what's called a geometric broken line repair. I encourage you to watch my scar revision virtual consult to really understand that. But I try to break up the visual element, in which case I do have to take some surrounding skin. I do have to close that incision, and I want to avoid tension on the closure. What I do, and also when I undermine, I mentioned that earlier, I didn't explain it, when I undermine the tissues here, totally different from the rest of the face. This is why I've got to explain this as a separate video. I do this all the time, and I said I've got to shoot a video on this. Because when I undermine here to take the tension off, because when you cut this, let's say I cut a big circle out and I try to close it, and it's under tension, I can't close it, the scar will look bad. So the problem with that is that when I remove that, the issue is that I just undermine underneath the skin. This area, that's a mistake. The blood supply is a problem. So if you remember what I showed you, it slides. Where does it slide? It slides like the forehead. There is a layer, so it goes skin, fat, this connective tissue muscle layer, and then there's this loose tissue above the periosteum or lining of the bone. It's the same sort of structure up here where this slides like this, but it's different from this where it doesn't really slide. So I have to undermine all the way below the SMAS, big term again, superficial musculoapparatic system. It just basically means the muscle layer. The reason I do that is there's less tension on the closure, but the real reason is that the blood supply is preserved. If I just undermine the skin of the nose and try to close it, it will not heal well. And so if you have a scar on your nose, if you've got a mole on your nose, you have to understand these principles. Another principle of the incision is following what's called relaxed skin tension lines. And that's, if you watch my mole virtual console or my scar revision virtual console, I talk about this. And I encourage you to watch either one depending on which situation fits for you. But basically, a relaxed skin tension line is under magnification. You'll see that there are collagen bundles in different directions. And by doing that, following that, it closes better. Now, there are some exceptions. For example, I just saw a gentleman last week where his mole was in the middle, and usually I would make an incision this way because it's along a relaxed skin tension line. But I know that if I make a more vertical incision for him, it will follow how a light reflex hits the nose, and your brain will see it as a light reflex rather than a scar. So there's so many permutations to this concept of how I do scar revisions and moles on the nose. Sometimes I'll just tell you it's not worth it. When I, for example, very classic, if there's a mole sitting on this area of the nose, I would most likely just shave it and have the high recurrence rate, yes, because once I cut this and I cut full depth, the nose can notch. I can't close it. I've got to do bilobe reconstructions to try to correct that, which I've done. It's not worth having big reconstructive incisions all over the face for this. I do that for cancers. But for a mole removal, most likely if it's sitting somewhere down on the tip, I will probably shave it. And unfortunately, you're going to deal with a recurrence in, there may be a recurrence in a year, maybe in 5 years, maybe never. May take a couple rounds to manage it. But those are the areas that in general, I'm hesitant to cut it away and try to close it because there's too much risk of distortion and problems. So hopefully this video on mole removals and scar revision for the nose will help you understand it better, understand how I do this differently. But I really encourage you to listen to my videos on scar revision, mole removals, how I use botulinum toxin or Botox to manage scar healing, multi-layer closures. I don't go through all of that in here because it's too much information. I just want to talk about principles for scar revision and moles and why it's so unique on the nose versus the rest of the face.